Now, government says it is shocked at what it is calling the inconsistent position of the Ghana Medical Association towards the implementation of the drone delivery system after their association's General Secretary, Justice Youngson, supported its implementation at the initial stages. The Ghana Medical Association on Tuesday demanded the immediate suspension of the medical drones contract, accusing government of failing to consult the association. But speaking to journalists on Wednesday, Deputy Information Minister Pius Hajide revealed that the General Secretary of the Ghana Medical Association, Justice Youngson, pledged the association's full support for the rollout of the drone system when he met the Vice President earlier this year.
The drone health delivery system is expected to cater for the distribution of essential medicine and drugs and blood to essentially our rural communities. Government is aware of the various feedbacks that have greeted the introduction of the technology, including that from the Ghana Medical Association. Indeed, at the 2018 Annual Health Summit in Accra, the Vice President Alhaji Dr. Mahmoudou Bawumia announced to the Ghana Medical Association government's intention to roll out the project as part of efforts to ensure effective healthcare delivery. The Ghana Medical Association welcomed the decision by government, and to quote the General Secretary of the GMA, Dr. Justice Youngson's reaction to the announcement, and I quote, "Well, as for us as an association, on countless occasions, we have bemoaned the state of emergency medical service in the country. So, if efforts are being made by the government to ensure that we strengthen that sector, we strengthen that aspect of our healthcare delivery, then we say kudos. Government is therefore taken aback at the current position of the GMA when it says, and I quote, "The proposed services to be provided by the drones do not conform to the primary healthcare policy in Ghana." Ladies and gentlemen, the drone technology, like other technology introduced into the health delivery system, fits well into the primary healthcare policy towards the achievement of universal health coverage. Last week, I personally joined officials of the Ghana Health Service and Zipline Company Limited to outline details and engage the media on the creation of awareness. Government is committed to ensuring effective healthcare delivery in the country, especially in the rural areas, and we believe that the drone health delivery system will largely make an impact aside other measures to improve the health sector. Our doors remained open for further engagements and consultations on this project, which is to benefit the citizens of this country. The Akufo-Addo administration will continue to improve the healthcare system and services for the well-being of citizens.
That's Deputy Information Minister Pius Hajide there. He says he also noted that government can only give clarity to various stakeholders who do not understand the concept, as the drone service will not be scrapped.
Once the Parliament of Ghana has passed the deal, it is now binding. We are grateful to Parliament for that. It is now binding, and we expect that in the shortest possible time, implementation will commence. Government is, however, willing and ready to engage with any stakeholder who seeks to engage with a view to giving clarity on the matters on which they may lack understanding and clarity. We think that the GMA may only require a further explanation on the matter.
Pius Hajide there. We're learning that the Vice President has been meeting with leadership of the GMA this afternoon. Well, we can try and get some more details from the GMA. We're trying to reach the GMA to speak to them. As when we have them on the phone, we will get that information from them. Were they totally cut out of the consultation processes? Because that's the position they put out yesterday. But as we said, the Vice President is meeting with them. We're monitoring that meeting, and we'll bring you up to date as and when.